Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press star 0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Ms. Jennifer Major, Senior Improvement Lead at the Canadian Foundation for Healthcare Improvement. Please go ahead, Ms. Major.
Thanks very much, and hello everybody, and welcome to today's on-call webinar that is called Improving Transitions from Child to Adult Care. I'm Jennifer Major. I'm a Senior Improvement Lead here at CFHI, and I'm pleased to be your host today. We're really excited to announce that we have over 200 registrants for this session, so we look forward to all of you participating today. So as I introduce the guest speakers, or before I do that, I ask you to please take a moment to introduce yourself in the chat box. We see that a lot of you are already telling us about yourself, so that's great. Continue to do that. In addition, if you could kindly let us know how many people are attending from your location using the poll at the bottom center of your screen. So please enter the number, including yourself. Also, before we begin, I encourage you to all join the conversation about improving transitions on Twitter. So take a picture of you and your colleagues attending the session, share your comments and views on the issue, and tag CFHI. So welcome everybody, welcome to our speakers today, and I'm just going to give some brief introductions of everybody who you'll hear from today. So Kush Amaria is a clinical and health psychologist in the Department of Psychology and Division of Adolescent Medicine at the Hospital for Sick Children. In her current role, Dr. Amaria serves as a team lead for the Good to Go transition program and works to share evidence-based practices that support the transition and empowerment of all youth with special health care needs. This includes leading Sick Kids Good to Go Transition Clinic, which is an outpatient program that provides treatment and support to any adolescent with special health care needs or chronic health conditions struggling with transition issues. Deborah Thull is a social worker who coordinates the Well on Your Way in Transition program at the Alberta Children's Hospital in Calgary. She's been working in the area of adolescent transition for the past 9 years, assisting ambulatory clinics at the Alberta Children's Hospital to develop adolescent transition programs that focus on patient readiness using a family-centered care approach. Chantal Krantz is a manager of connected care at the Children's Hospital of Eastern Ontario, or CHEO, and Chantal oversees the Transition to Adult Care program. She's been working at CHEO for the past 23 years and has more than 15 years experience building partnerships and managing programs that coordinate access to care for the medically fragile and vulnerable pediatric population. All three of our speakers today are contributing members to the Canadian Association of Pediatric Healthcare Community of Practice for Transition to Adult Care and the National Transition to Adult Care Guidelines for Special Needs Youth, which we're going to hear more about on today's webinar. I also have with me in the room Sheena Powell and Kelly Ripley, who are operating behind the scenes and are the people who produced the webinar that you're all participating in today. So welcome again to all of you, and please continue the conversations through chat. We are also today pleased to provide simultaneous interpretation for the webinar. This may result from time to time in a few quick pauses in the dialogue today. So we do invite you to participate in our chat box in either official language. So before I turn the webinar over to Kush, please let us know in the chat feature, what is it that you want to know about improving transitions from pediatric to adult health care? You know, tell us what your burning questions are and comment throughout the webinar, and we're going to be sure to address these questions, or we'll do our best to address the questions during the webinar via chat and at the discussion segment that we have after all three presenters are finished with their technical slides. So I'd like to now hand it over to Kush, please, who will get us started with a review of today's webinar objectives.
Great. Thank you very much, Jen. So we've got some key objectives for today, and essentially we really want everybody on the line to be able to have an increase in the knowledge and be aware now of the recommendations, the tools, and the resources, including people, and the strategies that you can one day implement to support improvements in transitions, both in the short term and the long term with your population. And these, of course, are coming from the Canadian Association for Pediatric Health Centers. We also want you to be able to learn from others on how to prioritize and make changes and become aware of the network of individuals that are interested in improving transitions for Canadian youth with special health care needs. So, we know that most of you are appraised of the need and the importance of transitions care planning. Therefore, we'll do a really quick Transition 101 review to get us all up to speed on the vocabulary. Now, the most widely cited definition of transition is a purposeful, planned movement of adolescents with chronic medical conditions from child-centered to adult-oriented healthcare. Our transition COP has modified this definition to note that it is also supported by individualized planning in the pediatric and community settings, a coordinated transfer of care, and, of course, secure attachment to adult services. Now, we all know that transfer is this one-time event that's going to occur when a youth is transferred out of the child health system and into the adult healthcare system. Now, what exactly is a COP, or a community of practice? It's an informal learning organization and that shares concerns, problems, and a passion about a specific issue. This is an innovative model, and it really exists to align the interprofessional learning process and knowledge translation that exists within a community. Now, what does this exactly look like for CAPC? This slide is really a quick way to capture the collaboration in the national community that developed over the past 4 years. Now, our CAPC Transition COP is composed of stakeholders from across Canada, and this includes frontline clinicians, allied health professionals, researchers and administrators from both adult and pediatric settings, from all levels of care, home care, rehabilitation, community, tertiary hospitals, and families and youth in transition, all of which want to improve and support the transitions of Canadian youth with special health care needs. So, the goals for our CAPC transition. Essentially, back in 2012, mostly in response to a report that came out of the American Academy of Pediatrics in 2011, at that time it was concluded that nearly after a decade of effort in the field that there was still not widespread implementation of healthcare transition supports. This was no longer, or this currently was not the basic standard of care. It hadn't been realized in over 10 years of research. So CAPC underwent this process to develop national Canadian guidelines, and these guidelines were going to exist to influence transition at both the personal and clinical level, ultimately to prompt change over time to the system level, to ensure that all youth and their families have access to a supportive process for transitioning from pediatric to adult health services, and really to ensure that healthcare providers have the tools and the training necessary to support families and youth in this process. Now, of course, the scope of CAPC's community process is within the healthcare system. And we understand that it's necessary to include and make provisions for all the other systems involved in a successful transition, whether that's education, housing, social services, etc. So our COP's biggest accomplishment was the recent release of our guidelines. It's entitled A Guideline for Transition from Pediatric to Adult Healthcare for Youth with Special Healthcare Needs, a National Approach. Now, these guidelines are aimed at youth aged between about 12 to 25 with special healthcare needs. And this includes physical, developmental, and/or mental health conditions, and of course their families, all of which require ongoing health surveillance and care to be able to maintain the optimal level of health well into their adult years. Now, this general and widespread application in terms of the target population was purposely chosen, and it was to allow the development of a guideline for use by all professional groups, allied health providers, families, caregivers who are involved in the care and transitioning of youth with special health care needs. Ultimately, we want this guideline to support the development of a successful transition framework from pediatric to adult care that is going to result in individuals who are better equipped to navigate the system and better equipped to manage their own health. So what will you find in our guideline? You will find 19 evidence and consensus-based recommendations that are at the personal, clinical, and system level. And the details, of course, are in the guidelines, but in brief, these are based on over 3 years' worth of work from a review of the literature, consensus surveys with over 250 respondents. You'll find a repository of tools that will continue to grow, and I'll explain more about that in a moment. We really want these recommendations to be translated into practice. And finally, you'll find examples of the latest widely accepted frameworks and models for implementation and evaluation. And of course, the link here will take you to the full guideline. So we don't have, obviously, the opportunity to go through each recommendation just now, but I want you to know what you'll be able to find in this guideline. You'll know that you'll receive, or you'll see, the 19 recommendations, and it'll include all the evidence review, the process of the development, the references, all graded by the level of evidence. And here's one example. For example, recommendation number 7. At the clinical level, we're looking to ensure that there's a developmentally appropriate, individualized transition plan that is prepared and documented in collaboration with youth and family, and the level of evidence is provided. More importantly, what you'll come to learn throughout the process of developing the guideline is that our COP really grew. Now, it grew in part through our collaboration and our ongoing commitment to knowledge exchange. So this included monthly presentations from national programs, sharing of articles, education videos, and materials through email and on CAPC's Ken. Now, who exactly is Ken? Ken is our knowledge exchange network, and it's here where you'll find our growing repository of transition tools and inventory materials, everything from policy statements to transition planning tools. What's most important to know about this is it is a living document, and it's expected to grow with our growing and our active COP over time. Again, I encourage you all to take a look. Now into the exciting news. At this point, we're really going to make the change. We're going to really hear about some examples of the excellent transition work that has been happening across Canada. We're going to start with Deb Toole. I'm just going to double check. I don't think we've got any pressing questions right now that we could answer very quickly, but we promise to have time close to the end once again. So Deb is going to explain some of the examples of work being done in the Alberta Health Services Centre Services Program in Calgary Zone to improve transitions for young adults with complex care needs. Thank you. I pass it over to Deb.
Thanks, Kush. Can everybody hear me? I'm the Adolescent Transition Coordinator at the Alberta Children's Hospital in Calgary, Alberta, and I work in the Well on Your Way Youth and Transition Program. And as Jen has already said, my primary role is to develop tools and resources and work with outpatient clinics to help them prepare their patients and families for the transition to adult care. In this role, we have developed readiness checklists for patients and families, charting documents for clinic staff to track transition progress, a website, and various other resources that clinics can use to help support their patients and families during the transition process. However, today what I'm going to really focus on is another role that I have, and that is my work with clinicians, patients, and families to help support the transfer of care where transition is more complex. And so I'm going to focus on 3 Alberta Health Services initiatives in the Calgary Zone that were designed to improve transitions for young adults with complex care needs. The first program was based on collaborative work between the Alberta Children's Hospital and the South Health Campus, which is an adult acute care site here in Calgary. And the focus of this program was to develop support for patients with complex care needs as they transferred to an adult acute care site for their inpatient and emergency care. Attending an adult emergency department or an inpatient unit can be a very scary time for patients and families as they transfer to adult care. It can be a time filled with lots of anxiety and frustration. I've heard from patients and families, as well as from clinicians at adult acute care sites, that sometimes adult acute care sites don't have appropriate size equipment for smaller patients. Things like blood pressure cuffs, IV needles, catheters, lifts, and sometimes the healthcare providers at adult acute care sites are unfamiliar with the young adults' complex care needs and their treatment plans. So basically this program was designed to help build capacity of the adult healthcare providers to prepare them in advance to manage the complexity of patients' acute care needs, to transfer information from the pediatric to adult healthcare providers to increase the adult healthcare providers' confidence as well as access to critical care plans, and to engage and build confidence in patients and their families with complex care needs during the transfer of care. So in a nutshell, what this program offers is patients and families an opportunity to meet with healthcare providers at an adult acute care site prior to the transfer from pediatrics to adult care, so that the information about their complex care needs can be communicated to emergency departments and intensive care units in advance, and arrangements can be made to address these needs. On this slide, you will see that all the opportunities that the transition visit can include. I'm not going to go through all of them. You can read them. But basically, the success of this program is the key to it is really the role of the patient and family support specialist, because this is where the bulk of the coordination and support happens. Because the patient and family support specialist receives the referral, she follows up with the patients and families, she books the visit, she determines what needs to be included in the transition and appointment, she makes arrangements for all of these meetings, and then is the initial point of contact when the patient and family arrive at South Health Campus. The appointment always begins with a tour of the site, and if the patient and family have requested a meeting with the manager of the intensive care unit, then this meeting will take place during the tour of the intensive care unit. Following the hospital tour, then the patient and family meet with the emergency department manager and physician to share key patient information and any specialized care needs, as well as create a patient record at South Health Campus so the information is readily available to all healthcare providers when the patient arrives for the first time. After the emergency department registration visit, the patient and family will then reconnect with the patient and family support specialist, meet with other healthcare providers that they've requested, and then prior to the end of the visit, the patient and family support specialist will connect with the family one last time to do a debrief and provide them with her contact information so that they can contact her if they have additional questions, either before their care is actually transferred there or after their care has been transferred there and they have concerns. So when we developed the program, we consulted with several key stakeholders in healthcare, but the most important part for us was engaging patients and families in the development of this service because we wanted to be sure we were meeting their needs. So we had 2 teen and or young adult focus groups provide us with feedback on the content and the delivery, and you can see those 2 focus groups on the screen. The one was the South Health Campus Citizen Advisory Team, and the other one was the Alberta Children's Hospital Child and Youth Advisory Council. Following the pilot, we also surveyed patients and families and the healthcare providers that were involved to understand their experience and to determine if the goals of the program were being met. And the response was overwhelmingly positive. Here's some of the feedback that we received. One family member told us that many fears and doubts were eased and the staff and site are fantastic. Another family member said, there is an understanding of the fear that a severely mentally challenged child would have with intrusive procedures. And one of the physicians in the emergency department said, some of these adolescent patients have very rare conditions that most emergency physicians may not be familiar with. Having the meetings beforehand with patients and families helped me to realize that while the care is specialized, it's not unlike the care we provide for some of our complex adult patients, and that the care measures we take for any critical ill patient would also apply in these situations. The second initiative that I'm going to talk about is the Calgary Zone Successful Transitions Committee. And at its inception, this committee was a partnership between Calgary and Area Child and Family Services, Persons with Developmental Disabilities, and Alberta Health Services. Over time, the partnership was expanded to include adult guardianship and trusteeship, assured income for the severely handicapped, home care, transition services, etc. And what we're finding is that this type of cross-sectoral collaboration is very important in supporting those with complex care needs during transition. So referrals to this program came from case managers or frontline staff from any of the partner organizations. And the way the process worked was the case manager would contact the Successful Transitions Coordinator to consult about the case. And if the person had multiple complex needs that could not be resolved by the Successful Transitions Coordinator alone, the case would, and the case warranted further consultation, the case would then be presented to the Successful Transitions Committee by the case manager. Other key professionals that might be involved in the case were included in the meeting, as well as family members when it was appropriate. Discussion with the management representatives at the consultation meeting centered around developing an integrated care plan, and this was accomplished by sharing ideas about resources that would best meet the identified needs. The committee members committing to work within their organizations to find innovative ways to address the complex care needs of the cases presented, identifying responsible systems, and then the management representatives from those organizations that were attending the committee meeting agreeing to take action. The integrated care plan would then be documented and emailed to each of the committee members for follow-up on their action items. This program was evaluated in 2010, because this initiative goes back a long ways, and a final report was written. And that report reviewed the work of both the committee and the coordinator. It highlighted the data collected and identified the key transition issues that are faced by complex youth that are involved in multiple systems. 41 surveys were done, representing the cases that had consulted with Successful Transitions Coordinator over the course of a year. And those surveys indicated that only 9% to 17%, depending on the type of service being accessed, were encountering difficulties in connecting with the services they needed. And 83% of the respondents had found consulting with the Successful Transitions program either helpful or very helpful. So in addition to the direct impact on referred youth, the committee members also built on the collaborative relationships that were developed within the committee and found additional opportunities for shared planning and problem solving. That collaboration and cross-organizational understanding by the partnering organizations built the capacity of the committee members so that we are all able to better help support our patients and families and help them navigate the available supports and connect them with the appropriate resources and people. Over time, the shared planning and problem solving that happened outside of the committee meetings resulted in fewer referrals to the committee, and as the referrals decreased, other collaborative opportunities increased, and so there was a decision to combine the Successful Transitions program with the Calgary Complex Needs Cross-Ministry Committee, and at our last Calgary Complex Needs Cross-Ministry Committee meeting in September, the committee agreed to evolve further and move towards establishing an unmet needs committee to address the service needs of those who are ineligible for existing adult services in a more integrated way. And the third program that I'd like to talk about is the opportunity to connect complex patients and or their families with a family physician. Many of these patients have been followed by pediatricians and pediatric subspecialists for years, and they have no relationship with a family physician. And finding a family physician that feels confident and able to provide the care and supports that they need can be very challenging. As the family physician is often responsible for care coordination in the adult care, finding a good medical home for these patients is critical. And so, like the other initiatives I mentioned, this too is collaborative work, and this was work based on collaboration between community pediatricians, the Calgary's own primary care networks, and of course the Alberta Children's Hospital Well On Your Way program. The goal of the project is to connect patients with complex care needs to primary care physicians a year or two prior to the transfer of care, so that the transfer of care is more gradual and less abrupt for patients and families, so that we build the capacity of the family physicians and their confidence in providing the care that these patients need and coordinating it. And so that pediatricians and family physicians collaborate and communicate throughout the process to ensure that patients experience an uninterrupted and coordinated care during the transfer process. A key to the success of this is that pediatricians agree to stay involved on a consult basis for a period of a year following the complete transfer of care, so that family physicians have some ongoing support in caring for these patients with complex care needs post-transfer. We are in the process of evaluating this initiative with the different primary care networks to determine how many patients with complex care needs have actually been attached to family physicians in each catchment area, as well as what's working and what isn't, based on surveys and or interviews with those who participated in the program. Interview guides have been developed, and we're in the process of sending out invitations to referring pediatricians, receiving family physicians, as well as patients and families, to invite them to participate in this evaluation process. An interviewer who has not been involved in the initiative has been engaged to elicit feedback, and I'm really looking forward to the learnings that we gain through this process and try to improve on this initiative. So I don't see any, as Kush indicated, I don't see kind of any burning questions, and there will be an opportunity for people to ask questions at the end. So I think at this point in time, I'm going to turn it over to my colleague, Chantal Krantz, Manager of Connected Care at GEO.
Thank you, Deborah. I hope everybody can hear me. I'm also here with Christine Gregory, who's our Nurse Care Coordinator on the Champlain Complex Care Program. So I'll start off by talking to you a bit about our GEO On My Way Transition Program, which is a program that, corporate program that we developed back in 2012, in collaboration with our youth forum, we have both a family forum and a youth forum that's very long-standing at the Children's Hospital that helps us shape and address some quality issues and improvements. And so the youth forum was actually very much part of helping shape what this program would look like and what would be helpful for teens as they're leaving CHEO. And the model is one that is a shared management model where the clinicians gradually encourage a shift in knowledge and responsibility from the healthcare provider to the parent, and finally through the child and youth as the young person matures in age. If you want to know more about our toolkit and some of our program, you can go to our website, which is at the bottom of this slide. So I'll just talk quickly about some of our key principles of the corporate program. Is to start early and foster autonomy as it relates to the developmental milestones, involve the child and youth family in the transition planning, use a planned and coordinated approach, ensure a progressive movement towards active participation in health management. That transition requires, as Deb has mentioned, a coordinated collaboration and communication among youth, family, healthcare providers, but also with respect to youth with complex special needs. The healthcare team in the community and community-based services are extremely important for this particular population. We reframe leaving the Children's Hospital as an achievement and celebrate, as many families have been here for 18 years, and leaving is difficult for parents, youth, and teams as well who've worked with these families. Our program is not one size fits all, so the way we work is my role is to work with individual teams within the hospital and help them implement the program and tools as they fit their particular population. And in turn, the clinicians, when they're working with families and teens, will tailor their approach to that particular individual. So it's definitely not a one-size-fits-all, and we're continuing to continually evaluate. So I want to talk about, we want to talk about this particular population, which is, for the purpose of this presentation, is a complex special needs youth who either have developmental or physical disability. We worked in collaboration with the Ottawa Children's Treatment Centre, Ottawa Service Coordination, the Complex Care Program, and the neurology team to try to develop a toolkit that would best suit, support, and ease the transition for teens and their parents, as well as clinicians, because there's a lot to know. So when we're looking at this particular population, the top yellow part of the triangle is really our most complex 1%, and that's our Champlain Complex Care Program that helps support the transition for this population. But the top part of the triangle, which includes a little part of the blue, is really around 12 to 18% of teens that are leaving CHEO that would benefit from this toolkit. So I'll just talk quickly about, so Christine will talk about some of these processes that we do use at CHEO as we work with a team, an engaged team. We have engaged physicians. We always do a needs assessment with the team before we implement something new, and we always do a survey with teens and their families before we start so that we get a sense of what they need. So Christine's going to go through how we did this specifically with the Champlain Complex Care Program.
Thanks, Chantal. So prior to implementing or developing a toolkit that would meet the needs of this population, from the needs assessment prior to the implementation, we found that there was no formal program in place. There were some tools, but nothing that we sort of formally had put together. There was no evaluation process either. So for teens that were transitioning to adult care, there wasn't a mechanism to later evaluate how that process took place. We found that the transition with these youth typically ended up either being RN-led or by one specific person. So a lot of the responsibility was falling on the hands of just one person in particular, and we know that we need a shared
shared care process. We also found that the process was starting around the age of 17, and so it focused more on that transfer of care, not necessarily a process of transition. Community of organizations were not always understood and definitely underutilized, so not tapping into some of those organizations early. There was also a challenge getting specialists to consult the adult counterparts early, and so that was happening later, so that may be delayed, and imparting those specialists with the knowledge and having the opportunity for them to feel supported and get to know the youth prior to transfer wasn't happening. We also looked at some family feedback from families who did transition to adult care, and they had noted that there was a need to prepare earlier. They were requesting transparency and access to the necessary resources, and that they found this to be an extremely stressful time, as we can imagine. So from that, we did have a working group where we got together to look at what some of the gaps were and look at some of the transition tools that were already developed to see how we can adapt them to meet the needs of our population. And so from that, we did create a special needs transition toolkit, which we are just actually rolling out and starting to implement. So that's exciting for us. So within the toolkit, we created a special needs youth and parent readiness checklist, transition timeline chart, which starts from birth to 18 years. There's also a comprehensive special needs transition resource guide that will help the family with identifying other resources, funding sources, things like transportation, funding, Developmental Services Ontario, et cetera. All those things are outlined in the resource guide for the family, so it's sort of one-stop shopping for them. We've developed a 3-sentence summary for the parents and as well as the youth to use when appropriate to help them sort of take control of some of the health care and become autonomous and get comfortable in asking questions for when they're seeing different teams in clinic. We also developed a single point of care document, which we use within the complex care program. Really, it's a comprehensive medical summary detailing the different care needs of the child, and we do have a snapshot of that a little bit later on. And then it's also sort of similar to the Sick Kids My Health Passport, which the family can also create. Then we've created a guide for clinicians, which really looks at defining rules and responsibilities. So each clinician sort of will adapt it as they see fit to their clinic, but really we've looked at sort of a holistic approach of what needs to happen during the process of transition, and we've really tried to highlight some of those areas. So it's a bit of a checklist for us when we're meeting with the families in clinic that we're really hitting on each of these topics and identifying where there may be some gaps. And then, of course, program evaluation. So we are in the process of evaluating some of the teens who would have and families who would have transitioned prior to having this program in place, and then looking at post evaluation as well. And then we provide a transition letter for families, and then the celebration, of course, that they have made it to transition. And so you'll see on your screen now is just a snapshot of our comprehensive medical summary, which is a single point of care document. Really, families speak to the usefulness of this tool when they're going into an emergency department or if they're going to a new clinic for the first time. This is a snapshot of sort of all the care needs. It's a brief summary of their story from birth, really, so that when parents are sharing, about the teen, or when the teen is sharing about their experience, they don't have to sort of recollect back about, what happened in the course of their really detailed and complex medical history. It's all there in a snapshot. It has their details of all their technology. So if they're, ventilator dependent, it will have their most recent settings on there. We also put in key findings from tests and also a baseline assessment of their medical, where they're usually sitting. And so families are really thankful for having a document that really outlines all of their comprehensive care needs. And so this is something sort of specific to the complex care program, but like I said, you can also create the My Health Passport as well.
And then the second tool that we wanted to highlight was the Special Needs Transition to Adult Care Workflow Guide for Clinicians. And so we looked at other centers' tools as well, including OCTCs, to look at what are the different categories that they're looking at in terms of transition. Yeah, sorry, Ottawa Children's Treatment Center. And so we've tried to break it down between age group so that we can use it as a guide for ourselves to highlight, what are the things that are coming up that we really need to look at. And it's not to sort of have all those things fall on the hands of one team member, but really to look at as a whole, what are the different activities that should be taking place to really ensure a smooth and seamless transition to adult care. And so our steps to success, we found an early introduction to transition, the concept of transition and transparency. So providing the toolkit, letting the family know what resources are out there. We find that knowledge is power, and they're really wanting to have that information early. Transition planning meetings, and so we're starting to plan those even earlier rather than at 17, but starting at 14 and including the community partners. Embedding the new tools into our clinic workflow so that we're making sure that we're making use of these tools, but then also tailoring them to each use capacity. So again, with that concept of not one size fits all, and knowing that may change dependent on each use. And then documenting in our electronic medical record is helpful for transparency amongst the different teams, because in complex care we deal with many specialists, and so it's helpful to know where each team is at. We're not having to chase specialists to find out if they've already engaged in the transition process, but if it's documented in the EHR, then we can see that more readily. Like Deb said, an early connection to the PCP, and so we're actually recommending that we start that hunt for a PCP at the age of 14. Many of our kids are followed by pediatricians, and so there's a hesitancy as well from families to really engage it with a new provider, and it's a stressful time for them, but we're really trying to highlight that if we start early and we find someone early, we'll work with them so that they get to really understand the uniqueness of the youth as they transition. Making sure that they have that SPOC, or a completion of a comprehensive medical summary. And then in terms of the adult provider, we are also offering that support from the CHEO specialist 1 year after transition, where the adult providers can connect with the teams just if they have any questions or need any advice or want to run something by them, that support is there. And then the teens and families can also access EPIC, which is our electronic health record, 1 year after discharge, and so that they can go in there and see some of their results and have that at their fingertips if they need.
Okay, so this is the end of our section. I guess I can take a look at one of the questions here we have from Linda Piazza, and you're looking at thank you for your positive feedback and looking for practices and approaches that are being spread across the region. I think one of the things I'd like to say from CHEO is that we didn't have any particular dedicated person to help us develop this, so we knew right away that when you have limited resources, you really got to look at what's already been done, and so thank you for the community of practice through CAFC is really how we were able to see what's being done across Canada. Many of our tools have, as you'll say with permission from Sick Kids or with permission from Vancouver Children's, we're often using a lot of the same things. So if you're working in an organization and you're not sure where to start, I think the community of practice is a great way to start, and don't reinvent the wheel. There's many tools. And even when we were trying to develop a surveys for satisfaction with our staff and with our teens and families, there's a lot of great starting points from the community of practice.
Okay, I'll just extend a thank you to our speakers and for the questions and comments that are coming in through our chat box so far. So thank you, Christine, Chantal, Deb, and Kush for your information so far. I just want to give everybody, I'm sure everybody's been following the chat, but just a sense of who is on the line today. So we have, for example, several family members who are navigating transitions currently with their child. So for example, Joanne has joined us. She's a parent of a 19-year-old boy with complex needs. She lives in Alberta, and she's still trying to navigate the transition to adult services for her son. Linda is a parent of a son who's transitioned from pediatric oncology to adult care, so she's on the line with us today. We also have many healthcare providers who work with families who are experiencing and going through transitions. For example, occupational therapists, nurse practitioners. One of the occupational therapists, Tara, that we have with us today, she does a lot of skills-based programming in clients with physical disabilities and is about to open a transition clinic at a local rehab hospital focusing on teens with physical disabilities. So welcome to the people I've mentioned and also everybody else for for joining us today, and we really do hope to hear more from you throughout the rest of the session. So we'll open it up for questions now. Before I go to the formal questions, Kush, do you have any comments for the listeners today in terms of how the CHIO and the program at the Alberta Children's Hospital speak to the recommendations that you described from the Canadian Association for Pediatric Health Centres?
Absolutely, Jen. Thank you for that. And the first thing I really want to say is how all these examples of these activities that have been presented by Deb, Christine, and Chantal, they really truly reflect the work of their own, of the local Alberta and Ottawa communities of practice. Remember, again, these are just a collection of folks that have a common interest. They share concerns. They understand the problems that youth with special health care needs were facing at the time of transitions. And I think it's a great example of really seeing what the goal of CAPC at the broader sense, besides just the development of the guidelines, which really was to bring Canadians together who were interested in this issue. I think what also really stands out between the two of them is ensuring that the voice of youth and families are heard. We all know the importance of engagement by patients and clients, but the reality of executing that can be challenging and yet so rewarding and important. And again, I think these examples are reflected in the descriptions provided today, and they're also really reflected in our guidelines and our recommendations. At the end of the day, we want the support that youth receive to be individualized. I think the other thing that really stands out, and I think you sort of highlighted, Jen, already, is just this, it's great to see the breadth of participants' roles when I kind of scroll through the chat and people have provided their feedback on the organizations they're from, the roles they're involved in. I see that there are some folks that are actually from the adult centers. And again, CAPC is the Canadian Association for Pediatric Health Centers. And we want it to not be so, we certainly want to be as inclusive as possible, and we're still looking for more of that along the way. I think at the end of the day, I'll answer one of the questions that came in. I believe it's from Arlene Chavez from Toronto Central CCAC. And essentially she was asking, how are you engaging adult primary care providers to take on the care of these complex patients? And I think it's an important question that we are certainly trying to address with kind of our next stage. And back to sort of echoing on what Chantal had offered about the dissemination plan for CAPC. And so these guidelines were just recently released, just this past summer. And I think our next year is really about deciding how we ensure spread. So each of us are doing that in many different ways within our own organizations, within groups like CPS. But relating that back to Arlene's question, essentially, we also need to go to the primary care providers organizations, the family physicians organizations, and say, these guidelines exist. Review, think about how you would engage your partners to be part of this. Understand the real challenge that not all of the patients, but many patients with complexities experience through transitions. I think that really, again, speaks to the idea of the ultimate goal of our guidelines was to build very specific recommendations that were based on evidence, to spread that across the country, essentially, and then from there to really get the next stage going, which is implementation of this. So I'll take a break for a moment, Jen, just in case you've got anything else. Otherwise, we can follow through with some additional questions.
Sure, thanks. Thanks for your response to that. So I have tracked some of the questions that have come through the chat, and so I'll just read one of the questions that we have, and maybe I'll turn it over to Deb just to have the first stab at it. So someone had asked, and I didn't get the name, so what role do you think quality assessment has in facilitating efficient transition was one of the questions. Deb, do you have any reflections for that one?
Well, I guess I'm thinking if we're talking quality assessment, I actually think of assessing patients and families' readiness and ensuring that we are addressing and starting early to ensure that patients and families have the information that they need. Patients are ready and equipped to be able to start managing their medical care, advocating for themselves, determining where they're at, what resources and supports they need in the community. Are those linkages being made? And, are we starting early enough to attach them to those resources, as I think Chantal and the CHEO presentation mentioned? Those are all, so assessing, where the patients and families are at, kind of what their needs are, that individualized transition plan. Krish talked about that as that's one of the items in the guideline, and it's just really important to assess each individual patient and family and what their needs are kind of early on, and then begin working with them gradually to kind of prepare them and put the resources and supports in place. So yeah, quality assessment is really critical, I would say, in terms of the transfer of care process, because it's where you start the initial assessment, and then just ongoing assessments over the course of the next several years to ensure that you are actually doing what with your interventions are being successful, and you're actually getting them ready for the transfer of care.
Okay, thanks for that response. I also have another question from Jay Barton. So she's asking, what advice would you have for a parent who's supporting their child's transition from child to adult care? So maybe Chantal and Christine, if you have any reflections on that. And I guess Chantal and Christine, in addition to that question, I wondered too, will the CHEO Complex Special Needs Transition Toolkit be available on the CHEO website? So those are two questions for you to provide reflections on.
Okay, so yes, the toolkit is already there. It's on the website right now. Our standard toolkit for the majority of youth that are leaving CHEO is there on the website, as well as our complex special needs toolkit. So in terms of answering when parents are not supportive in the process, what kind of advocacy you do. I know I don't know if you have some experience you want to speak to specifically, or?
Well, I think it's not an uncommon thought for a lot of our families. We hear that quite early on, like, is there opportunity to extend care? Like, they're worried about the ability of other specialists on the adult side to be able to take over the care. And so really we're trying to engage them early in this transition process and really helping to improve their readiness, so that when they feel that when the time comes at 18, it's not new concepts for them, that they already feel like that they're good advocates, that they're aware of the different resources that exist, that they've already met sort of their case managers, they know who they're going to be aligned with, and that we've already identified sort of those specialists and started to impart some of that knowledge to really help to ease some of that anxiety and stress. For sure there are instances where, because of the child's health care, where they're at in the trajectory of their health, like we're not able to transition at 18, and those are a special circumstance where we'd have to look at extending their care in that instance. But generally speaking, we really try to have successful transition with all of the teens and adolescents, and really I think it's just including the families in that process and really helping them to become engaged in it and realizing that they're also a stakeholder in the process and that they have a voice, and really working with them to empower them throughout their time with us in complex care, but also once they the child reaches the age of 18. And for sure it's a vast variety with our teens and with their abilities to sort of self-advocate, or whether it's going to be the parents that take on that role. So really helping either the parent or youth to obtain those skills, I would say. Yeah, and the other thing I would add, too, to what Christine said is that a lot of clinics are now, especially those that have implemented this corporate approach, we want to standardize this across the organization, is making sure even some of them are actually seeing their adult provider once before they are officially discharged or transferred from CHEO, and that's a help, because then we can make sure the loop is completely closed and they are connected. So I just thought I'd add that.
I hope that answers the question.
Thanks. Yes, thanks. And please share, through chat, any of the participants can ask for further clarification or follow-up, or also provide their thoughts on the answers to these questions as well. I have another question. Maybe, Kush, I'll put this one to you, from Tara, who asks, she understands how to evaluate transition programs at an individualized level with tools like the COPM or transition readiness tools, but how do you evaluate programs at the larger institution level? So what are the indicators of success? So perhaps, Kush, you could give some reflections of that based on the work that you did with the recommendations and in your experience at Sick Kids.
Certainly, no problem. Thank you, Tara. That's a really great question. I'm glad that you're actually even recognizing that it has to be evaluated at both levels, right? At the level of the individual and, of course, at the level of the system. And so one of the sections in our guidelines is really a complete sort of description, up-to-date description about how you then go about doing this. In essence, sending people to the right resources, not having to reinvent the wheel. And in this section, we kind of describe some current systematic reviews. We talk about the GOT Transitions organization out of the United States, which has actually provided tools to healthcare providers to rate where a program is at in terms of, or program, even an institution actually I should say, is at in terms of being sort of a gold star transition program. And it can be everything from looking at the number of patients that enter the system at the appropriate time, in the appropriate time frame, that are not lost to follow-up. It can be things like satisfaction from patients and parents at the broader level. It can include whether a policy, a transition or transfer policy exists. So there are these sort of 6 indicators from across the literature that say, if you've got these things going, that's a sign that you are ahead of the game in terms of transition programming and planning. In truth, it's sort of a $1 million question. How do we truly define successful transfer? We could probably do that. And how do we truly define successful transition? We recognize it's multifactorial. My experience being sort of a supporter of transition program development throughout the Hospital of Sick Kids is we start with something is better than nothing, and we start by not reinventing the wheel, using tools and resources that currently exist. We ensure things are individualized, and we ensure this idea that we work as a community, that we work as an organizational community to be able to move forward in that way. Thank you.
Thanks very much. That's a great response. I'm just scanning through the questions now, and I did have somebody who was asking, or Linda from CHIO is actually with us, and she's the chair of the Patient and Family Perspectives Working Group with Pediatric Oncology Group of Ontario, and she's actually had indicated in the comments that she's interested in hearing about best practices in oncology transition specifically. So I'm not sure, do any of you, Deb perhaps, do you have any experience or reflections or information specifically on oncology transitions? And if you don't, maybe someone, Chantal, Christine, or Kush, you could comment?
I don't have any specific, experience with apart from working with the oncology clinic here to help them prepare their patients and families for the transition. But I do know one of the things that, especially because we do tend to kind of keep them here at Alberta Children's Hospital, that is one of the patient groups that stay here and are followed here for 10 years after their treatment and after they've kind of gone into remission, and so they could be quite late when they are transferred actually to adult care. But I think the really key thing that they are telling me is the importance of finding a primary care provider who is going to follow up for all the late effects of some of the treatment plans that oncology patients had when they were under active treatment. And so that, I think, it goes back to the whole primary care piece, and ensuring that you have a good family doctor and that the family doctor is engaged early on, and the family doctor is very aware of kind of what the treatment plan was, during the intervention years, and kind of what, ongoing follow-up, what things need to be followed, post-transfer. I think somebody had had asked the question about engaging adult primary care providers. And I know here in Alberta we have primary care networks. And so I found that engaging executive directors at the primary care network level and having them go out to their physician group to kind of, find out who has interest in different patient populations, and, has really helped with the attachment process for those who are more difficult to attach. And we actually had a meeting yesterday with the medical director of primary care networks, and he said that, his experience has been that, family physicians have a strong social conscience. For example, when there was the refugee crisis and they were looking for family physicians, there was a massive uptake. And so, he said it really is just letting the physicians know about the need and, providing them with some support so that they don't feel that they're taking on the care of these patients without any support, that they're, going to have to navigate a system that is broken or siloed without support. And so I think as we prepare patients and families and provide them with the wraparound supports that they need during the transition process and as they transfer to adult care, then I think primary care providers feel supported and aren't as reluctant to take on the patients either. So that's my take on the oncology, but maybe there's someone else on the call who has more formal experience.
Thanks, Deb. And I did see that Kush put up the Pediatric Oncology Group of Ontario might have some guidelines that apply to other provinces, so maybe that's another spot where people can look for information on that. And then Linda from the Ottawa Hospital Cancer Program had mentioned there's an after-clinic transfer from pediatric to adult centers that follows many of the practices discussed today. So there's going to be time for one more question, and then we're going to just have some closing reflections and a few other just pieces of information. So another question that was raised is from Sheila, asking if there's any special protocols any of the speakers know about for children who are crown wards or who are foster children, essentially. Does anybody have any experience with that? Chantal?
Definitely not the expert, and we're trying to uncover the best way to support families who are doing foster care. So we have been working with complex care, one of the experienced social worker that was in neurology, and also our pro bono lawyer here to try to come up with something that's easy to guide parents and also clinicians so that we're giving correct information. I don't know if Kush, you would have more expertise, or Deb, because your background is in social work, but that right now we're still trying to uncover. I know that obviously we want to, the legal guardian for the youth is always someone who we need to keep in the loop, and sort of balancing that education along with the foster parent and youth, and also the legal guardian. So details about Crown wards, I don't know if Kush or Deb would be better to answer that.
I'll just add, so it's Kush speaking. In truth, I also am not aware of anything specific, but again, the guidelines are really designed to be as general as possible so that they are applicable to any young person with special health care needs that are in the process of transitioning between pediatric and adult care. And I think with review of that, review of other sorts of supports, it becomes clear that if the recommendations are put in place with additional partners potentially that are not maybe aligned in the target users, that things can move forward.
Thanks, Kush. And Deb for that response, and Chantal for the response as well. So Kush, I'm going to turn it over to you now for your reflections, your final reflections, and for you to take us through what the next steps of the participants can be before I give some final reminders.
Excellent, for sure. So, the first step, of course, if you haven't already, is to encourage you to review the guideline document. We certainly want members and individuals who are interested to join our community practice. Care of Lisa Stromquist, and her contact information is there. And really to think more about how you would spread the word within your organization. And this includes anything from tweeting to emailing to just reminding people that these guidelines exist. Think about joining Ken or taking a look through Ken and contribute your tools, any program information and resources, and we can add them to CAPC's online transition tools and inventory. As I said, this is a living document, and we want to continue to add items to this tool and inventory so that we have a repository that all Canadians can have access to. And also, since we've heard such great examples about transition programs and recommendations, I really encourage people to think about what can you do next? What can you do in the short term? And that can be anything from really thinking about what your own transition task force would look like. Find those other individuals in your community that will meet for coffee and review what's really happening in your organization from frontline to top-down approaches. And if you're thinking about kind of more long-term strategies, take advantage of the idea of the systems that already exist to try and evaluate where your organization is currently in terms of the transition process. And think about that framework to help move forward in terms of your planning for implementation and improvement. And of course, continue to raise awareness by asking questions and sharing your stories. Hashtag improve transition. Thank you very much.
Thank you very much to all of you once again. So I just wanted to closing, I just wanted to talk about briefly a program that Canadian Foundation for Healthcare Improvement runs, and I encourage you to consider attending the November 15th informational webinar that's about this program. So the program is called Extra. It's a fully bilingual, team-based, pan-Canadian improvement executive training program. So over the course of 14 months, teams of 3 to 4 participants work collaboratively together to design, implement, and evaluate an improvement project that addresses a priority clinical or organizational challenge. So for example, your organization could apply to develop and implement an approach to improve transition from pediatric to adult care. And your team can include a family member, a family advisor. You can partner with multiple organizations to plan and develop and implement this. So I really encourage you to, on November 15th, sign up for the webinar that CFHI will host that will provide you with an opportunity to hear more about the program. You can also feel free to get in touch with anyone from CFHI who can put you in touch with the right person to discuss further. So next, I'll just briefly mention some of the upcoming on-call webinars. So on October 27th, we have one called Shifting Care from Hospital to Home. November 7th, Catalyzing Improvement and Innovation in Canadian Healthcare. And November 15th, as I've mentioned, that Extra, the informational session about Extra. And you see the web link there to look at CFHI's full lineup of on-call webinars. So we look forward to your future participation, and you will note that in the survey that we're going to ask you to complete today, we will ask you specifically if there's any other topic areas in the area that we've talked today, improving transitions, that you'd like to see more on. And we're more than happy to consider those suggestions, and maybe we'll have you on for another webinar on this topic. So your feedback really is valuable for us to inform future webinar design, so we ask you please to take a moment before you sign up to provide us with some feedback on today's session. And we also invite you to sign up for our CFHI newsletter and keep an eye on your email for a full listing of upcoming webinars. So once again, I'd like to thank all the speakers today, Kush, Christine, Deb, and Chantel for their excellent presentations and all of your excellent participation through the chat feature and for sharing resources and stories. And I also thank Kelly and Sheena, of course, for working behind the scenes to make this webinar today happen. And again, thank you to all of you on the line. So this concludes today's webinar. Please have a lovely afternoon, and we hope to be in touch with you again soon.